If we have something that works in a rodent, is it going to work in humans? I recommend it to all of my academic colleagues that they should all go and spend some time in industry. That's what worries me. We are not making fast enough progress to come up with new treatments for some of these diseases. If we live to more than 80, 1 in 6 of us will have dementia.
Welcome to another Innovative Greeks Talks. We have the great privilege today to have with us Chas Bountra. Chas is the Vice Chancellor for Innovation at Oxford University. He's also professor of a very interesting field of medicine, Translational Medicine, which we'll talk about in a minute. But he's also the director of the Center for Medicine's Discovery, which is obviously, I think, one of the most topical issues at the moment. Everyone's talking about what changes will happen in terms of medicine's discovery over the next 10 years. On top of that, Chas has real experience of going from what they say the laboratory all the way to bedside, or from the environment, some people call it from bench to bedside. So the idea is people who can see through all the way from research all the way to a real medicine that cures people of very serious problems. In fact, Chas is one of the people, the key people that came up with the first really effective medication for irritable bowel syndrome while he was at GlaxoSmithKline as a director of biology over there. And just as a note, irritable bowel syndrome is one of the most I would say, widespread problems people have. I looked up that it's around 11% of the global population suffer from this disease. Now, you may be wondering why are we really talking about life sciences in the context of the Innovative Greeks talks? A number of reasons. The first, in my mind, is that if the world, the planet, was an app or it was a game, we would say that life is its main feature, right? Life is the main feature. And bugs within that system is what probably causes most unhappiness and misery and death. Therefore, de facto life sciences is something that probably comes first above anything else when we talk about human progress. The second reason, that is a very Greek reason, is that actually from ancient Greece to this day, ancient Greek philosophers were very concerned about the definition of life, the quality of life, less so I would say about the duration of life, but very much concerned. Plato, Aristotle spoke a lot about the science of life. So they're very strong I'd say, there's a lot of history in Greece behind life sciences that goes back to ancient times. And in terms of modern times, it so happens that life sciences are the #1 startup area in Greece. 25% of all startups happens to be in the life science domain. And some of the most, I would say, celebrated Greeks happen to be operating in that space. Anyone from Bourla at Pfizer to Papadopoulos at Biogen, or Regeneron, or Galakatos as a life science investor over in the States, but also some amazing academics and thinkers and doers, like obviously Demis Hassabis, and also Manolis Kellis at MIT. So it's an area that in some ways has some Greekness to it, but is also a very promising area potentially about that concerns the future of Greeks and their startups and what they'll be doing over the next few years. So Chas, I guess my first question to you would be something that we started discussing just a minute ago. Let's maybe start with what is translational medicine, because I think it sums up the future of medicine and health in the sense of the multidisciplinary aspect of it.
So I suppose briefly, Marco, well, firstly, thank you for the invite. It's a pleasure to be here, and thank you for organizing this. But translational medicine, what we really mean is we're trying to take our science and our research and our innovations from the lab to clinical practice. You know, some of the challenges are often when we do research in the lab, often, of course, it's, for example, in animal models, rodents. And there's lots of questions about how relevant that is to what happens in the clinic. You know, there's no such thing as Alzheimer's in a rat. You know, we have models which we think recapitulate some of the pathways that are important in the clinic, but there's always a question, if we have something that works in a rodent, is it going to work in humans? So that's a big issue, this sort of translation from lab or non-human species to the clinic. I mean, one of the challenges we've had in the pharmaceutical industry, frankly, is that many ideas that we work on in the lab and many molecules that we come up with in the lab, and many of these molecules apparently work in animal models, when we've taken them into the clinic, either they don't work or they produce side effects. And of course, you know, for us to produce a new drug, it's got to be effective, but it's got to be safe and well tolerated. And that is a big issue, you know, so having efficacy and safety. So that's translation, taking from the lab into the clinic.
Excellent, I think, explanation of what it is. Let me ask you, the reasons you entered, and I say this because there are a lot of young people watching this, and I'd be very curious to hear your sort of motivations of entering this space as a young man.
Yes.
And how these motivations have changed, not just given your maturity, but also how this domain has changed. So it'd be interesting to sort of contrast why you went into this in the very first place and why are you into this now? What excites you anew?
Well, it's interesting. When I was at school, I was fascinated by biology, plants, animals, living things, etc. So my first degree was in London, then I did a PhD in Edinburgh, and that was basic biology. I then went to Oxford in the mid-80s, and I worked with some incredible people. And that's when I first got very excited about trying to use our biology knowledge to generate new medicines. And that's when I went to work at Glaxo, which became Glaxo Wellcome, then GlaxoSmithKline. And I have to say, working in industry, I mean, I would recommend that to everybody. I recommend it to all of my academic colleagues that they should all go and spend some time in industry. Because there I learned so much. I learned so much about how difficult it is to come up with a new medicine. You know, how difficult it is to come up with a medicine that's effective and safe, that's better than what's already out there. You know, the challenges we've just been talking about, that efficacy in rodents doesn't necessarily predict efficacy in patients. You know, these are big challenges. And one of the big challenges, of course, is that if we think of disease, any disease, let's take Alzheimer's. I mean, the Alzheimer's is something I worry a lot about because, you know, in the UK, for example, the population of the UK is about, what, just under 70 million. But we have currently 850,000 people with dementia. And in 2050, it's estimated we're going to have 2.1 million people with dementia. So it's going to more than double. And we have even
why is that? Why is that?
Basically, I mean, the figures are for all of us who live to more than 80 years of age.
It's a function of age.
It's a function of age. So if we live to more than 80, 1 in 6 of us will have dementia.
Yeah.
I mean, those are the statistics, etc. But the fact is, even though we've been doing research in Alzheimer's for decades, we've still not come up with a drug that slows down the progression of that disease. And it's a horrible disease. So my motivation as a student was because I just loved biology. When I was in Oxford, I got fascinated about sort of translational biology and trying to discover new medicines. And of course, that carried on in GSK, and I've continued it when I came back to Oxford in 2008. But you know, the other thing, sort of in life, we all have experiences, and they make you even more determined, etc. And so I can share with you a couple of personal stories. I mean, around about 2004-05, I was still working at GSK, and I went to visit a care home for sort of, there's lots of patients there with dementia, elderly people, etc. And I remember going into this care home, and in this one room, there was an elderly man, I think he was in his 70s, and he was just staring at the wall. He didn't even acknowledge I was there. You know, he was just in a world of his own. But his daughter was sitting next to him. So I spoke to his daughter for about 5 minutes. And she said to me, just as I was leaving, she sort of held my hand and said, "Please help my father." And at that time, Marco, I thought, it's too late for your father. You know, sort of nobody can help him, I'm afraid. Yeah. The sad thing is, if that happened to me today, you know, 2022, I would say exactly the same.
Yeah. And
that's what worries me. We are not making fast enough progress to come up with new treatments for some of these diseases. And Alzheimer's, sorry.
No. I mean, it's interesting because Alzheimer's is actually, I was looking at the statistics in the States, like 650,000 people die a year from heart disease, 600,000 people from cancer. The third is, of course, accidents, but the fourth is Alzheimer's, actually. As you said, of course, it's a function of age as well. It's highly correlated to age. But another interesting thing about Alzheimer's is you know, if you look at the mix of let's call it genetics and environment, it's one of those where I believe 70% is inherited or genetic, and that to me is both depressing because in my wife's family and my family, you know, there's a high predisposition for this, but it's also challenging in what you said. How is the model changing in terms of being able to intervene beyond the environment into things that actually may impact the genetics themselves?
I mean, you're right. I mean, you know, the reason some of these diseases are so complex, it's not that they're just purely genetics, it's genetics and environment. And, you know, another area that is becoming an increasingly big problem, I believe, for all societies. It's certainly a big issue in the UK. I'm sure it is an issue across the whole of Europe and the whole of the world, is mental health. And, you know, and some of those conditions, unfortunately, they have often been developing for decades, you know, early life experiences, abuse in childhood, etc., etc. But all of these diseases, I mean, all of these conditions, I think they are massively affected by environment, by diet, by sleep patterns, by exercise, you know. So I think there are things that we can do to mitigate those things.
Yeah. The interesting thing is, as you said, the mental related diseases, which at last I think are being now properly recognized as something you can talk about openly. You know, I don't think that was the case as I was growing up. It was a very sort of very cryptic kind of, scary area for most people. But yeah, I was shocked to see that it's one of the top killers in the States, like 50,000 suicides a year, right? But I think this leads to this interesting question about, are we really moving from a point where the main concern was death to a point where we're beginning to seriously consider quality of life and well-being, right? Because going back to the ancients, the ancients were not particularly concerned about death as much as we are. Like, our civilizational culture has been conditioned to strive for longer life. The ancient Greeks were more concerned about a good life, quality of life, which is why I think they had an obsession with eating, exercise, you know, mental health. The agora, you know, was a form of, I would say, probably mass psychoanalysis.
Yes.
and you know, beating things like loneliness.
Yes.
So they had thought about these things a lot. It took us centuries, I think, to come to some of these things, back to some of these things with a more scientific approach. And you know, my question to you would be, we are at a point where biology is coming together with computer science, and you know, you have guys like Demis Hassabis or Manolis Kellis, you know, for example, and this is supposed to be a real revolution, right? The idea that biology comes together with computer science or mathematics, and we try to almost re-engineer the way our system works, right? Could you talk to us about this a bit? Because you're right at the forefront of that at Oxford. How is it changing things?
Before I answer that, let me just touch on a couple of things you said. So, talking to one of my friends in the US 3 or 4 years ago, I said to him, which health condition are you most worried about in the US? Mm-hmm. And I thought he was going to say obesity or cancer or diabetes. What he said was loneliness.
Loneliness, yeah.
You know, so we think we're in this increasingly connected world with phones and, you know, we can talk to our relatives and friends on the phone, etc. But loneliness is going up in the US, and I suspect it's an issue in lots of other places. The other comment, I think you're absolutely right. In the UK, for example, and of course I know the UK system, you know, the bulk of the cost to the health service are usually elderly people in the last, let's say, 15, 20 years of their life. You know, that is taking the bulk of the cost. And many people, let's say, life expectancy, I don't know what the exact figures are in Greece at the moment.
I believe it's close to 80, 79,
okay, so,
80. Yeah.
But I think it's something similar in the UK. But for most people living to the age of 80, the last 15 years, last 10 years are not pleasant years. They do not have a good quality of life. So I totally agree with you. Our focus should not be on necessarily increasing lifespan, letting people live to 150. I'm more worried about those last 15, 20 years that people have a reasonable standard of living, etc.
And the other thing you brought up, which I think is very interesting, is that there might be almost a generational, let's call it inequity being happening right now. Because, you know, you take the United States, you said before, you know, 3 trillion spent on healthcare, of which my understanding is 70 or 80% goes to people, as you say, that are elderly, right? And in some cases, we forget about the main issue of quality of life and around loneliness, which actually affects many young people these days, right? Many, many young people. And this loneliness then leads to actually very serious mental disorders, right? And very little money or effort or research is going into that domain. And I would say very little public policy is moving into that direction as well.
And so I think maybe, Marco, this is why I feel pretty optimistic at the moment, because I do think the comments you made a few minutes ago around computational science and data science, etc., you know, I do think that medicine and healthcare, we're going to see massive changes in the next couple of decades. And it is not because of clinicians and biologists. It is going to be because of mathematicians, data scientists, computational scientists, engineers, material scientists, etc. I think they are going to transform healthcare in the next couple of decades. So I think, I know that you feel very passionate about this, but I think that if we are to realize some of those innovations quickly, we absolutely need people from different disciplines coming together. We need computer scientists inside the medical school. We need engineers inside the medical school. We need mathematicians and statisticians inside the medical school. And one of the reasons I'm a little optimistic is because these conditions we've just been talking about, you know, mental health, Alzheimer's. You know, if you take Alzheimer's, we give it one label, Alzheimer's disease. But, you know, Marco, if we had 100 patients here with Alzheimer's, they would all be different.
Yeah.
They would have different ages, weights, obviously different sexes, etc., different diets. But some of them, you know, they will have maybe forgotten where their keys are, but others will not even recognize their own children. Some will be aggressive, some will be agitated, some will be depressed. So all of these diseases are incredibly complex. They're incredibly heterogeneous.
You're so right. And I think actually, you know, the way in which we were almost forced to simplify something that is incredibly complex, this thing called life, right? Created many problems. It was very debilitating, right? It's a bit like trying to turn life into a computer game that has like 5 bars: strength, endurance, intelligence, whatever. And in reality, if you click on any of those bars, there will be millions of iterations of, you know, take intelligence. I mean, being a parent and thinking about these things a lot, it's so ridiculous to consider intelligence as being one thing. You know, intelligence comes in so many different forms. It's so complex, and it hasn't even been studied adequately. But simplifying it into, you know, competency tests like SATs or, you know, IQ tests, which are just plainly ridiculous with the knowledge we have. What I find fascinating, quite frankly, is that the minute computer science and mathematics started entering the world that, in my mind, matters the most, which is the study of life, right? And health, mental or physical, the leaps started becoming apparent very, very fast. You know, the speed with which Demis, for example, let's call it decoded the folds of protein at a pace that would take previous practice, forever, probably. I don't know how long it takes to even handle one fold, is an indication of what's coming, and what is possible, right? And giving life the complexity, like the understanding of the complexity deserves, both in terms of disease or even skills or attributes or anything like that. So what I'm seeing, you know, from the younger generation is something that makes me very happy, which is 10 years ago, 15 years ago, 20 years ago, when I was getting into technology, most people wanted to make money. Purpose was of a limited importance, right? And I think a lot of people viewed it as a game, a challenging game of the mind. How do I get more clicks? You know, how do I, automate certain processes that, in the general scheme of things, are not that important to life, like ordering food from your home. We are now entering a time where I think younger people are very concerned about purpose. They no longer want to be working for companies that are doing trivial things. And they are naturally drawn to startups that deal with important issues. And that space, if we call it life sciences or healthcare, seems to be really sexy. And it's probably the first time it is being perceived as a sexy space by, I would say, people who would not normally be going into that space, right? Because traditionally, I think people who went into that space were very scientific, very good students, very, very sort of focused on a particular area. Now you're seeing generalists wanting to enter that space. And that makes me very optimistic. What makes me a little pessimistic, and maybe we can talk about that, is how behind the rest of the system is. Take drug approval, right? FDA. If we are moving in a direction of personalized medicine, not having 10, 15 year cycles of medicine coming out into the market, but much faster, you would need a completely different system probably to produce these kinds of results. So an FDA, not of biologists maybe, but an FDA with AI experts. What are your thoughts around this?
You've raised so many points. I think we could talk here for hours, actually.
But let's focus on the how can the system change to make medicine approved and get to the bedside or to the patient faster than what's happening today.
So let me try and answer that in two ways, and I'll touch on something you said a little bit earlier. I also am very optimistic. I mean, I work in, we like to think, the best university on the planet. And by definition, we access incredibly smart people, smart students, researchers, faculty. These individuals are not just smart, but they're creative, they're passionate, they're determined, they want to prove to the world that they're right, etc. And it's great working with individuals like that. But I've noticed it in the past few years. Many of these young kids are coming to me now and saying, I don't just want a traditional career. I don't, in Oxford, there's a degree called PPE.
Yes, the politics, philosophy, and economics.
Absolutely.
And for the viewers who may not know, this is a very celebrated degree that kind of almost describes what Oxford is all about.
Well, so, many people come to me and say, look, I don't just want to do a PPE degree and then I go and work in Goldman Sachs and then become the next Chancellor of the Exchequer and the next Prime Minister or whatever. I want to focus on some of these big global problems. I don't want to have a boss. I want to be my own boss. I want to learn how to be a leader. I want to learn how to be an entrepreneur. I want to learn how to write a business plan. So I've seen a massive culture change in Oxford just in the past few years, etc. Going back to your point about precision medicine and the regulators, I think I have to say I'm very proud of the regulators in the UK. It's interesting that the Pfizer vaccine, the first place that it was approved was the UK. And I think the regulators...
And the reverse was not true.
Well, I mean, our vaccine, the Oxford AstraZeneca vaccine, has yet to be approved.
It still hasn't been approved in the States, which is ridiculous, of course.
It is, of course, even though it's been into 3 billion arms, etc.
It reveals the problems with
nationalism, politics.
Nationalism applied
absolutely.
To the cost of the detriment of health.
Absolutely. But you know, I was talking to a friend of mine. So let me step back a bit. The two things that I lose most sleep about is I worry about healthcare. I mean, that's my own area of expertise. And in the Center for Medicine's Discovery, you know, we're working on dementia, mental health, rare diseases, cancer, inflammatory diseases, diabetes, all of those things. And each of those are massive problems. You know, you take cancer, I mean, half of us will have a diagnosis of cancer in our lifetime. That's the statistics, etc. So, you know, I worry about that a lot, aging societies and so on and so forth. But Marco, what I worry about even more is the climate emergency. This planet is changing, and the changes are going to be irreversible, and the impact they are going to have on health is phenomenal. You know, the incidence of many diseases is going to change across the world. Many parts of the planet are going to become uninhabitable, etc. And that frightens me a lot. Now, in that climate emergency, you know, we could be talking about, oh, we need to increase biodiversity. We need to increase food production for the planet. We need more clean water. We need better batteries. We need to capture carbon from the atmosphere. We need fusion power, whatever. And in Oxford, fortunately, we've got people working on all of those things. But what I'm trying to say is actually, although I've categorized them into two things, the climate, of course, the environment, has a massive effect on health. You know, the other day, I mean, this is obvious, but the other day somebody said to me, in India, you know, where they have droughts regularly, there are farmers who all their crop has gone, and some of those farmers are committing suicide. Now, of course, you know, that's logical, but that is happening now, you know, and, you know, we've seen in the past 3 years, you know, we've seen massive fires in Australia, in Siberia, in Portugal, in Greece, in California, in Brazil. We've seen flooding in London and in New York, in Germany. You know, we've seen, you know, 52 degrees in Vancouver. We've seen roads melting in India. This climate emergency is happening now. Right? So, but I think that there's lots of links between all of them. But, you know, the comment I was going to make about the regulators, one of my very good friends is a guy named Matthew Wood, a brilliant clinician, a brilliant scientist, a brilliant entrepreneur in Oxford. And he's become a role model in Oxford because he's now set up a few companies, and now, of course, faculty, other academics, researchers, students are looking at him and they're saying, well, if he can do it, we can do it. And role models, I think, is incredibly important. But Matthew works on rare diseases. And he gave a wonderful lecture the other day, and you know, often we've quoted that across the world, there are 7,000 rare diseases. But if you add up all the patients, it's 350 million patients. And many of those, of course, are affecting young kids. Those kids, many of them don't reach the age of 5. 95% of those kids have no treatment whatsoever. So can you imagine being a parent with a child with a rare disease and there is no treatment? And, you know, many of those diseases are rare, so the pharmaceutical industry is not going to work on them. So who's going to come up with treatments for those kids? Those parents of those kids have no hope. You know, it's a big issue. But the other day, Matthew said in this lecture, there are 200,000 hyper-rare or ultra-rare diseases. So I sat there thinking, you know, we can't even come up with, we put all this money into curing cancer, we've not done it. We put all this money into trying to come up with treatments for Alzheimer's, we've not done it. You know, when we've been talking about 7,000 rare diseases, 95% of those kids still don't have a treatment. And now Matthew's telling me there are 200,000 hyper rare or ultra rare diseases. How do we catalyze this? How do we scale this up? Because there are parents and kids out there who literally have no hope.
Could it be that a lot of a lot of the money going into healthcare is going into the wrong places? I mean, I wonder if one was to analyze the 3 trillion going into healthcare in the United States, what's your view on how the mix needs to change to begin addressing some of these issues that you talked about?
Well, of course, that 3 trillion is literally to pay for the hospitals and the doctors and the nurses and the, you know, all the scans and everything else. And of course, we realize in the US, because of the litigious culture, you know, any physician there will do every single test, and it may not be completely necessary. So I suspect there's a lot of stuff that's happening that is probably not necessary. But here we're talking about research. And the fact is, we just have to accept it. If we added up all the research money that there is across the world, it's just not enough. You know, these are all big problems, you know, whether I talk about Alzheimer's, if I talk about cancer, I could talk about pancreatic cancer or ovarian cancer or brain tumors or whatever, or esophageal cancer. All of these, you know, there's no treatment for them at the moment, you know, and, you know, those are death sentences, etc. So, you know, we could all make a case we need more money in each of these areas. I've just talked about the climate emergency. There is not enough money there at all. You know, I think we should be putting 10 times as much money into fusion power or something like this, because we should not be trying to come up with solutions in 3 decades. We need those solutions in the next few years.
Plus, I think it's human nature, you know, when you set very long-term objectives, they're very rarely met. When you set shorter-term objectives, you know, typically humanity works better that way. You know, it's no coincidence that Kennedy said back in the 60s, you know, we're going to have someone up in the moon in 5 years. And they did it. But he didn't say 30. He didn't say 40. He didn't say 50. And, you know, I think it's what you say, this sense of urgency. Perhaps, you know, it's gradually becoming more of a compelling narrative for voters, for people. And maybe this might affect politics. The trouble being that I do think that we are dealing with solutions that by their nature are so complex, you know, that your typical politician just doesn't understand. And
well, it's interesting.
You know what I mean? Like take for example, the shambles that the European Commission made out of their climate change policies. I mean, the management of this process of going to carbon neutral in Europe over a number of years, you know, was so badly designed, it underestimated things like energy costs so much that, in fact, we could very well be back to scratch now with the cost of energy going as high as it has, even excluding the Ukraine. So, you know, this is one of the things that concerns me, is that things need to be understood in order to be executed sometimes. And these things are very complex.
You raise again a number of important points. I mean, firstly, you know, if I think of the lessons that we've learned in Oxford in the past 3 years of the pandemic, you know, during the pandemic, you imagine beginning of 2020, when, you know, January we heard about this virus in China, etc., etc. You know, in March, in the UK, we had our first lockdown, and everybody was seeing it. you know, we were told not to go to work. The shops were closed. The airports were closed. The cinemas were closed. The roads were empty. The hospitals were full. Hundreds of people were dying every day in the hospitals. We had no vaccine. We had no treatment. But Marco, it is remarkable to me what my colleagues who generated that Oxford AstraZeneca vaccine did, you know, and they all came together, senior colleagues in the university, our Regius Professor John Bell, our Vice Chancellor Louise Richardson. They got together with colleagues from government, from the regulators, from other funders, Wellcome, Gates, etc. But importantly, from industry, AstraZeneca. Yeah. Pascal Soireau and Mene Pangalos, who heads up their research, etc.
Yes, yes.
They all got together and said, right, okay, how can we create a vaccine as quickly as possible to get the world out of this pandemic, and we're not interested in making money? The university said, AstraZeneca said, we're not interested in making money. We just want to get the world out of this pandemic. And it is stunning that these colleagues, in 9 months, they produced a vaccine, something that would have normally taken 9 years. So I think you're right. When we get people together and create a single goal, a single vision, real urgency, and funding is not limiting, then it's amazing what we can do, because we can be more risk-taking. We can do things in parallel. Because normally when you develop a vaccine, you would do things sequentially. But at that time, there just wasn't time to do that. Everything was being done in parallel. So I think there's a lot of lessons to be learned. So I've often thought to myself, I think to myself on a daily basis, you know, how can I get the whole might of Oxford University together, get everybody just thinking about, worrying about, working on the climate emergency? Because this is something that requires all of us, you know, sort of, it requires people inside the medical school, it requires engineers, it requires computational scientists, it requires behavioral scientists, social scientists, humanities people, etc., etc. You know, with the other lesson for me with the vaccine was, so in the UK, the vaccine is given for free to anybody in the UK. But even so, there are many people, many nurses, many care workers, many doctors who refuse to have the vaccine. I cannot understand that. So it's free, but they still refused it, right? When we're talking about the climate emergency, there we're saying we need to get rid of our petrol guzzling cars and buy a £60,000 Tesla or something like this, or we need to get rid of our gas-fired central heating and get, you know, air source heat pumps that cost £20,000 or something. Who's going to pay for that? You know?
No, I think you're absolutely right that, you know, at the moment we have sufficient evidence that when you mix academia with the private sector and there is a very precise objective and you have time pressure, results seem to occur. The vaccine, I think, is the most recent example. I heard back in a speech in Washington a few months ago, Fauci talk about the AIDS epidemic, which, you know, now it's gone. We've forgotten about it, but I remember myself back in the late 80s, this being, you know, an unsolvable tragedy, right? He sort of mentioned in his speech, you should really consider, for a person like myself being a physician, seeing every single one of your patients die, with no exception. And the kind of urgency this gives you, and the kind of commitment this creates, of course, 6 years later, you know, AIDS became a treatable, not I wouldn't say, he emphasized we have not solved it, but we have managed it, and so many other examples. So I guess you're absolutely right that it does come down to some form of prioritization, perhaps, because maybe we're trying to do too many things at once.
I think that is it. I wish, because, you were talking about, are we spending the money on the wrong things? I mean, I worry, for example, that across the planet, there are many groups, many labs, many researchers trying to do exactly the same thing in parallel. So you imagine people working on Alzheimer's or pancreatic cancer or whatever. In the US, there'll be many labs doing that. In Greece, there'll be labs doing it. In the UK, in China, in Japan. If somehow we could just get people working together, then we would reduce this duplication. Because the fact is, there is just not enough money to solve all the problems that we've got facing us.
I think you're absolutely right that, we live in a world today where the problems facing us can no longer be solved in either bilateral or solitary manner. I mean, it has to be a multilateral, sort of fully collaborative effort. And even let's take the West versus, or the US versus China divide. Sure, we do live in a bipolar world now, and for sure we're going into a new kind of Cold War of some sort on the economic level, at least. However, I am certain that there are exceptions, in these situations. Like, of course, when it comes to certain things like data, or when it comes to certain things like defense, I understand that, everyone keeps to their own. But when it comes to things like climate change, and it comes down to existential issues for the planet, perhaps, this approach could in fact be multilateral.
Well, I agree. And Marco, it goes back to, we're all human beings, whether we live in the US or Greece or China or UK or whatever, etc. Yeah. We all have two eyes, a nose, a mouth, etc., etc. And, Alzheimer's in the US is very similar to Alzheimer's in Greece, to the UK, to China. So these are global problems requiring global solutions. And you talked a lot about the environment, and I think the climate emergency is all about the environment and the impact of that on health. Those have to be international partnerships.
Let me ask you this, Chas, out of curiosity. Let's assume that, some of the most powerful universities in the world, if you put them all together, count to about 30. Right? I take the top, let's say, universities in the UK, top universities in the US, and a few more. Given that a lot of the knowledge coming out of these universities probably could inform a revolution in some of the fields we've been discussing, do these universities ever come together properly? I'm curious. Or does Stanford do its thing, and then Oxford does its thing, and then the Hart does its thing, and I don't know about the University of Beijing or whatever.
Well, I think I could answer that in a number of ways. I think, in general, universities compete with each other. But I do believe that, something that we've been pushing hard in Oxford is, we recognize we have great people and great resources and great infrastructure, great alumni all over the world, a great brand name, great convening power, etc., etc. But even in Oxford, we can't do these problems on our own. We have to work with our peer organizations. We have to work with industry. We have to work with governments. We have to work with the regulators. And importantly, we have to work with other countries. And that's, whenever I talk in Oxford, that's the narrative I'm certainly pushing, etc. You know, but, you know, you talked earlier about sort of, somebody said to me, I was listening to this wonderful man, Ian Chapman. He's the CEO of the Atomic Energy Authority based in Culham, just outside Oxford. And I heard him give a lecture just a few weeks ago, and it was about fusion power. And he said, you know, there was a lot of collaboration in the pandemic, you know, with the vaccines, etc. I actually said to him afterwards, I'm not convinced there was. You know, Pfizer didn't collaborate with AstraZeneca or Moderna. You know, it was a competition. And, you know, we talked earlier about sort of the Oxford AstraZeneca vaccine is not being approved in the US. You know, I think in an earlier conversation you and I were having, sort of, I was disappointed, frankly, by the comments of the French president or the German chancellor at the beginning of last year when they were rubbishing the Oxford AstraZeneca vaccine. Yeah. You know?
Which they did.
Unfortunately, I mean, I've always appreciated, having worked in GSK, you know, when science and commerce come together, there's tension. But here we've seen in recent years nationalism and politics as well. Yeah.
I think you're absolutely right. But, you know, I think what kind of flows throughout this conversation we're having is that on many different levels, collaboration is necessary to solve some of the problems that we're seeing today. And I know it sounds a little cliche what I'm saying, but, you know, in the same way that medicine comes together, biology comes together with computer science, and many other disciplines, actually. And this will probably grow. You know, you want to find a solution for cancer, you know, chances are the kinds of disciplines that would be involved in solving this would span across, you know, many different domains, right? Many different domains. And sometimes, you know, the problem begins from the most trivial and obvious place. Like before we started the interview, Chas was telling me, you know, Oxford's a great place because it's structured around colleges. Colleges tend to be relatively small, which means that in one place, people from many different disciplines live together, party together, drink together, form relationships together. And this multidisciplinary ethos exists from day one. And these kinds of environments can produce solutions for today's problems. I'd take Greece as the direct opposite, as I was telling you. You know, you have a different university for economics, a different university for medicine, a different university for biology and this and that. And all of these students probably never meet, right? And these disciplines go their own way. They don't interject. They don't collaborate. And I would say that unless that happens, and unless perhaps, you know, even the educational systems are planned in a way where they embrace the multidisciplinary approach as necessary to solve most of our most important problems, you know, this will not be fixed. But again, collaboration. Again, we touched upon collaboration when it comes to solutions, right? Big problems require big solutions and fast, and big solutions, as was evident from the vaccine. A certain amount of competition is healthy, but up to a point. Right, up to a point. If it's broken down in millions or hundreds of thousands of little disparate kind of battles around the world, it's probably not going to work. So, you know, perhaps universities should be a lot more collaborative.
I think
and then, of course, governments, right? The countries. You know?
I completely agree with that. I mean, it's, you know, I often say to people, I spend my life breaking down boundaries. You know, so in Oxford, we've got 4 divisions. In each division, we've got lots of departments. I don't like these silos. You know, we need to get people together, you know, and I break down interfaces with industry or with government or whoever, you know, with other universities. We need to get rid of these, and we just need to come together. These problems are so urgent, you know, they require speed. And we just need to sort of come together like we did with the, you know, the vaccine, etc. But the 2 words I would also add to the discussion, Marco, is trust and humility. You you know, to form a great team with everybody coming together, single goal, you've got to trust each other.
Yeah, yeah.
That is key. And, you know, when you're sitting inside the colleges, you know, these young 19, 20, 21-year-olds, you're absolutely right. They're living together, they're eating together, they're working together, they're playing together. That's where trusting relations are built, etc. I think that's key. I think the second thing is, I think we need a bit more humility.
Mm-hmm.
You know, we need to recognize that we can't do everything on our own. And we don't have the necessary skills, we don't have the necessary resources, we don't have the necessary infrastructure, and we need to come together. You know, in a couple of weeks' time, there's a major conference in Oxford on antimicrobial resistance, right? So you're aware, across the planet today, you know, there are 700,000 people dying every year because they are resistant to existing antibiotics. Mm-hmm. And in 2050, that figure is going to be 10 million. And I had hoped that after the pandemic, where we saw a virus go from one side of the world to the other, and we've seen how it's millions of people died, it destroyed the lives of tens, hundreds of millions of people, many people lost jobs, governments across the world have spent trillions of dollars getting vaccines and rescuing companies and all this sort of stuff. You know, this is what one virus going across the planet can do. Mm. With antimicrobial resistance, you know, we face a similar challenge. And again, I think the solution has to be, there is not enough money, we need to come together. We need to recognize that to come up with a new drug, it's estimated the costs are $2, $3, $4 billion, right? So, you know, you could argue, Marco, if we want a new generation of antibiotics, if you created a pot of, let's say, 10 billion and said, right, okay, Marco, here's 10 billion. You've got a decade now, come up with a new generation of antibiotics. I think it's doable, but for some reason, governments are not coming together enough and with sufficient scale and putting the necessary funds in. I mean, 10 billion compared to $1 trillion is nothing.
Absolutely. If I were to take the discussion now back to the level of a viewer who, you know, is sort of considering kicking off an effort to build a startup in the life science space, what would be your words of advice or wisdom?
Well, I don't know about wisdom, but certainly some thoughts. You know, what, Marco, amazes me on this planet of ours is how one individual can make such a difference. You know, I'm envious of Stanford, for example, because on the doorstep of Stanford, there are 5 companies at least worth more than $1 trillion. So I think Apple's 2.6, Microsoft 2.3, Alphabet, Google 2, Amazon 1.7, Tesla 1. But those companies, again, they're data technology companies created in the past 2.5 decades. They've become trillion-dollar companies. They have changed the planet. They have created hundreds of thousands of jobs. They've created many millionaires, and they've created quite a few billionaires. But it's individuals. Elon Musk, Bill Gates, Steve Jobs, Jeff Bezos. So I said to some colleagues yesterday, in Oxford, I'm always on the lookout for where is the next Elon Musk or Bill Gates, etc. So I think it's, you know, some of these young kids, they are incredibly passionate. As you said at the start, they care about some of the world's biggest problems. They don't want traditional careers. And they want to come up with solutions, and they understand data science and computer science and mathematics and statistics in a way that I don't. And, you know, so I think in their hands, the future, I think we have to be optimistic, actually.
I would agree with you that, you know, let's put it this way. The most important problems that we faced and we face are becoming mainstream. And more people want to attack those problems, you know, and solve them. That was not the case when I was growing up.
And let me just maybe just say these words, and I don't mean this as a criticism of anybody, but across the world, there are millions of researchers. But I think a lot of the people doing that research are just doing incremental research, more of the same. Fine, there's a place for that. We need that. But I think what we've been talking about today is we need innovators. People who are going to produce step changes, transformations. We need leaders, people who can inspire, enthuse, create a vision, bring people along. We need people who are entrepreneurs, who are going to take risks. You know, if you put a hurdle in front of an entrepreneur, if they can't jump over it, they'll go around it somehow, etc. We need more people who are great leaders, great innovators, and great entrepreneurs.
Chas, I thank you very much for this wonderful discussion. I look forward to our discussion at the Trilateral Commission, which is entitled Bits and Germs. You know, let's hope that we start working together more and more all across the world to solve some of these global problems. Thank you, Chas.
Thank you very much. Thank you.